So now let's talk about erythrocytes, or RBCs, red blood cells. So if we look at our red cells, they are very unique. They're non-nucleated, no nuclei. So they're present in your blood. They're the most abundant cell in your vascular compartment. And if you look at it, they live for 120 days lifespan. 120 days is the average lifespan. Okay, and if we see the RBC, the shape is it's biconcave. If we look sideways from the side, it's biconcave, two concave. So this is one concave end surface, this is another concave surface. You put it together and you get this shape over here. So biconcave, and it's shaped like a disc, so it's discoid. Not exactly a disc, discoid, because you see the center is a little thin in the center, lean in the center, and thick at the peripheries over here. Can you see the difference? So if we look at it, there is going to be less hemoglobin in the center compared to in the peripheries. So we have a periphery which has more color in it, more chromicity in the edges, and it is very faint in the center. Okay, it's very faint in the center. So this is your biconcave structure. It almost looks like a dumbbell when you look sideways, and when you look from the front, it is discoid in appearance, and its dimensions are 7.2 microns in diameter, 7.2 micrometers in diameter. It is around 2.2 microns at the periphery in thickness, and only 1 micron thickness, 1 micrometer thickness in the center. So you have less hemoglobin in the center over here. Now this is your biconcave shape. Please don't forget this. Discoid, biconcave, discoid shape. There are conditions where you have abnormal shapes, where the cells are not discoid, they're more elliptical or spherical. So they are not discoid and biconcave, they're more like ellipse or completely spherical, like round balls over here. So that's called spherocytosis and elliptocytosis. Spherocytosis and elliptocytosis. We'll talk about that in detail later. This shape is very, very efficient in allowing for the exchange of gases. It allows gases to exchange very successfully because the ratio of the surface area through which the exchange happens to volume ratio, which holds the hemoglobin, is the best. It's really high. So it gives a large surface area to volume ratio. This allows for good efficient exchange of gases across the membrane, so you can transport your O2 and your CO2. And the RBC count is, like I said, for females it is 3 to 5 million per milliliter of blood. For males it is 3.5 to 5.5 million per ml of blood. Not forget these numbers. Now these cells, if we look at them, they hold hemoglobin. The main thing is they hold hemoglobin. Hemoglobin is a very important molecule, and why we have these cells holding hemoglobin is because hemoglobin, like I said, it's got a heme and a globin. So the heme has iron in it, and what happens is hemoglobin, if we keep them in these red cells, it's safe. Iron is not free to cause damage to cells and create free radicals. So you cannot make hydroxide, superoxide, or peroxide from the Fenton reaction. So you don't want the Fenton reaction to take place. This reaction, whenever there's heavy metal in some fluids, it will make free radicals, which damage other structures, cells, and other proteins and other large molecules. So you don't want that. That's how the cells age and die. Free radicals. That's why there's all this hype about antioxidants that prevent the free radical damage, which the beauty industry also takes a lot of makes a lot of money out of. So other than that, these hemoglobin molecules are kept in the RBC. If they were left free, hemoglobin is very viscous, and it would make the blood very viscous, and that would cause an increase in the viscosity of your blood. And who's pumping blood? The heart. So the heart, if it had to pump this extra thick fluid, much thicker than normal, it would have a very bad day. It would actually go into heart failure. So you can cause congestive cardiac failure or cardiac failure. That's why our hemoglobin is kept in these cells over here, in these red cells, for that reason, to reduce the viscosity of blood. Some conditions are there where red cells are destroyed, like when you give the wrong blood, mismatched blood transfusion. Somebody has A blood group, you give B blood group. So those cells get destroyed by the person's immune system, and what's going to happen is the hemoglobin is released, and this is going to stress the heart out. It's not going to be able to pump very efficiently this very thick fluid, this slurry that has formed over there, this sludge in the vascular compartment. And these hemoglobin molecules, if they were free, they would attract more water through osmosis into the vascular compartment. So that would cause an expansion of the fluid volume. So here's your blood vessels, and these cells are holding the hemoglobin. If you destroy them and release the hemoglobin in the circulation, what's going to happen is a lot of this hemoglobin these free molecules are going to attract water osmotically, and this will cause an expansion of your fluid volume, which again will stress the heart out, and that's going to cause big problems over there. So it keeps the plasma osmotic pressure low. Okay, and that's very important. It reduces the filtration across the membranes, causing the swelling up of your vascular compartment. So your cells, they have this particular shape, like I said, biconcave, discoid. This is the shape, agreed, but it is not that the cells are fixed in that shape. It is not fixed. Your RBCs are very flexible. They're very flexible. Consider sometimes like these, consider a water balloon, a shaped water balloon. It has a particular shape, and when you fill it with fluids, it has this rough shape over here, like this. But if you hold it in your hands, then what's going to happen is the balloon can change its shape accordingly based on where it is. So that's what your red cells are like. They're very flexible, agreed, but they can morph a little bit. They have a little flexibility, because if you look at your blood cells, and this is your vascular compartment, your blood cells, they don't maintain that biconcave shape so perfectly when they're moving very fast. They actually look like a cartoon character who's running. If you watch the Roadrunner show, and Wile E. Coyote when he's chasing the Roadrunner, or all those cartoons where like Tom and Jerry, where Tom and Jerry are running, and they have this arch in their shape. It's like somebody's just wound up a ball and thrown it at full speed. So they have this parachute appearance. It looks sort of like a parachute. So this parachute appearance is because the red cells, if you see their size and the distance they're moving, it's like a Formula One car taking a sharp turn. So the speed with which they are moving is really fast for the scale, for their scale. So they actually move, and they have this parachute-like appearance. And if you look at the blood, when it goes into the spleen, the spleen has blood vessels, and the blood cells go through the spleen. The vessels are really narrow in the spleen. Most of your capillaries are around 7.2 microns, allowing one red cell to go like in single file through them. But when we look at the spleen, the diameter is only 3 micrometers. So this is the spleen. So what happens is, if your cells are young, they have flexible cell membranes, they can just weasel through and wiggle through that spleen and come back into the general circulation again, maintaining roughly their shape. But old cells which have damage to them, free radical damage, it happens with old age. So think why old people have liver spots. It's all old age, accumulation of damage. So these cells which are old, I'm going to draw them with a little bit of green or blue that symbolizes their damage. They get stuck, they're rigid, they're not so flexible because the cell membrane has become rigid from all the damage over there. So that gets stuck. So this is where the spleen is going to come and eat up some of the red cells. So the spleen has white cells over here, macrophages, your splenic macrophages. These are white cells in the spleen. You remember those monocytes? Yeah, those monocytes float in the circulation. Some of them settle in the spleen and they become the macrophages, the big eaters in the spleen. And they eat up any of these red cells that block the road over here, this capillary. And that's how we get rid of old cells and allow for the formation of newer, healthier, more flexible cells over here. So we'll consider this RBC to have a biconcave discoid shape. Yes, but it is very flexible, especially the young ones. So how is this shape maintained? There are some important proteins over here. There is a sort of underlying protein which maintains a scaffolding. So if you see some buildings, they have this rebar, these in the cement pillars in the building, they reinforce it with iron rods over there. This makes it more earthquake resistant and much more resilient. So this is your rebar. So this is the protein called spectrin acts like your rebar. It gives a sort of strength and shape to this cell. The spectrin is bound to the cell membrane via a special protein, and this protein is called ankyrin. So ankyrin binds the spectrin. So it's like an inner skeleton. Spectrin is like the skeleton. Ankyrin joins the skeleton to the skin over here. And there's another protein involved over here called band 3. These three proteins are very important. They become your RBC's cytoskeleton. And this is going to protect your, this gives the rough shape of your cell. And of course, it's very much subject to variation based on which vessels it's going through over here. So the shape is roughly maintained, but it's very flexible. That's what I want you to understand. Think of the water balloon, which does maintain a shape, but it can move a bit and change a bit within certain limits. So this is your cell, and sometimes damages to mutations where there are the non-functioning proteins, or you don't make ankyrin or spectrin, can cause the shape of the RBC to get messed up, and you get these cells which are spherical in shape. They don't have the biconcave appearance. This is called spherocytosis, or elliptical in shape, which is called elliptocytosis. These spherocytes and elliptocytes, they are more rigid. They don't have that flexibility over there, that skeletal framework which give a little flexibility to it actually. So you get this round shape, complete round shape. That's what all fluids want to be. If you consider, body fluids and wrapped in a cell membrane like your RBC, they want to be spherical in shape. But we want a balance between, flexibility, surface area to volume ratio. So we have this biconcave shape, but if you remove the cytoskeletal attachments, you get this spherical shape or elliptical shape. And what happens is spherocytes and elliptocytes get stuck in your spleen, and they can undergo premature destruction. So that becomes a problem. Okay, so spherocytosis and elliptocytosis can cause a reduction in the lifespan of your red cells, causing the early death of the red cells, and your spleen gets overworked for that, and that causes a lot of problems. We'll be discussing that later in anemia in more detail. Other than that, your RBCs, they have this ability to stack on top of each other. So this is an RBC. They tend to stack on top of each other if given a chance. So this is not clotting or coagulation. Please understand this. This is just stacking. It's like boys playing and jumping on each other over here. We call this Rayleigh formation. The X is silent. Rayleigh formation. Okay, it's not Rolex formation. Everybody would love a Rolex watch, yes, but this is Rayleigh formation. Okay, it's a cell stacked up on each other, and how this happens is because you have these cells, and most of the time what happens is, if you look at them, these cells have a little negative static charge on their cell membrane. This is static charge, not the RMP, resting membrane potential, equilibrium potential. You can watch those videos also, they've been uploaded. Not the static, this is static charge, not the bioelectric potential. So this static charge present on all of these red cells keeps them at bay from each other. It makes them repel each other. But if you leave cells to stand, with anticoagulant, you usually use an anticoagulant called trisodium citrate. So you take the trisodium citrate, mix it with the blood, so the blood doesn't clot. Now, what's going to happen? These cells, they tend to stack on each other eventually as time passes by. You get this Rayleigh formation. How is that? This negative charge starts, which is made by carbohydrates, by the way, carbohydrates. So remember cell membrane chapter, which we did in a cell membrane lecture? Yeah, these carbohydrates give a static charge. So it's causing, the static charge is caused by carbohydrates in the outside, the glycolipids and glycoproteins. These static charges repel each other. When you leave the blood unshaken, without too much of movement, what happens is plasma proteins are in your blood. These plasma proteins are going to cover these static charges. It's kind of like everybody with an ugly face. Nobody wants to date each other. Imagine there's a town or a village and everybody has ugly face, angry face. Now what happens is that it repels each other. Nobody wants to come close to you with if you have an ugly face with wrinkles and an angry face. Now you put some foundation and some lipstick on top and smile a little more often, and what's going to happen is you get a happier appearance and you are more approachable, and cells tend to stack and socialize with each other. This is one fun way of looking at Rayleigh formation. So this Rayleigh formation happens when you allow stacking of cells to take place, because the plasma proteins, especially the branched plasma proteins with a lot of branches, like fibrinogen, which is a clotting protein, very important for clotting blood. It tends to act like a foundation. You can even get your globulins. That's another kind of protein. If you have plenty of globulins or even albumin, but that's not so branched. So albumin is not a branched protein. I mean, it doesn't have too many branches. Globulins have a little, but fibrinogen, 6 branches over here. Very important.